Okay, this video is going to be new cancer treatment invented by me, Pete Rogers. Now, I have not actually used this treatment on a cancer patient, okay? I'm not a cancer doctor. I was just thinking a lot lately about cancer. Not that I actually wasn't thinking about cancer at all until I saw that I didn't get invited to the cancer meeting. And then, I had previously written an entire book on the biochemistry of cancer, and I had previously thought about it a lot. But I had just done quite a lot of reading about things that were directly or indirectly related to cancer, like mitochondria. I've read quite a lot about that. And it also turns out when you dive deep into pathophysiology and other organ systems, like I was reading quite a lot about the kidney, about autoimmune disease, it gave me ideas that would be helpful for cancer. Okay, so first of all, number one, something simple. Excessive iron activates mTOR, mammalian-targeted rapamycin, which is the pathway to initiate cell growth, cell replication. You want to slow that down to prevent cancer from replicating. So the first thing you could do is just donate blood to get your ferritin down to 90 to 30. Okay, that's sort of the ideal range. All right. The second thing is avoid all meat. Nothing from an animal. Animal food is obviously stupid if you have cancer. It causes a low-grade metabolic acidosis from the excessive amount of methionine. It also has all the sat fat causing insulin resistance. It just activates mTOR. You can't win with that. And all animal foods are bad. That includes eggs and dairy and fish and poultry. They're all bad. So 100% you have to avoid them. And you don't want to be half-assed. Half-assed is for losers. You want to do everything 100% right. Get your best possible chance, People are willing to sign up for chemotherapy, then they whine and bitch if you tell them they need to improve their diet. Basically, no one cares if you live or die except yourself. Maybe if you're lucky, your kids, your spouse, or something. So you have to care and you want to go for it. Okay, based on the people I've seen be long-term survivors, this relates to what they do. We talked about excessive protein being able to activate mTOR, and I think you should also be careful about plant proteins because I know T. Colin Campbell only spoke about animal foods, but he's using mono sources of protein like all soy or something or all wheat. In reality, we'll mix plant proteins, and therefore we can have the effect of increased methionine such that it's best to minimize all protein, all of it. Okay, there's some foods that are very low in protein, like a sweet potato is only 4.5% of calories from protein. Fruits are very low in protein, so I think those are good foods to eat. Those would be good examples of foods eaten by people like Ruth Hydrus, who survived, to be 90 years of age. She's still alive when she was diagnosed in her mid-40s with cancer. Cancer can run off glutamine alone, so you want your protein intake as low as possible. I think paleo keto for cancer sounds to me totally stupid because you're going to be high in fat, you're probably going to be high in animal protein, and that's just ridiculous, completely stupid. You need to have glucose because your red blood cells run on glucose, your brain runs on glucose, your immune system cells, when they're active, they run on glucose primarily. So, forget about any of these protein paleo keto stuff. I think that's stupid. Okay, then the next thing is how low can you go on protein? Now, we know you can go surprisingly low, all right? We know that, the RDA recommends 0.8 grams per kilogram per day, which is ridiculously high, okay? We talked about that before. A low-protein diet is 0.6 grams per kilogram per day, okay? That's still too high. That still doesn't give you full kidney protection, and that's still too high. You're not getting yourself out of the danger zone. I recommend you aim for something like a VLPD, very low protein diet, which is 0.3 grams per kilogram per day. That's what Kempner was feeding his patients with no supplementation. If patients go on this diet for a prolonged amount of time, like let's say a kidney failure patient to help prevent them from going on dialysis with CKD, chronic kidney disease, they might eventually have to supplement with EAA, essential amino acids, or with KAA. KAA means keto analog aminos, okay? So what a keto analog amino is, it's like an amino acid with the nitrogen removed. All of these things will reduce nitrogen. And the reason you want to do these is because high protein diets, they activate mTOR and they induce an anabolic state that also causes hyperlipidemia and some insulin resistance. You don't want that. So you want to minimize protein as much as possible because what you're basically trying to do here is like a Fabian strategy with the cancer. You're trying to starve the cancer. Your body can run quite well on carbohydrates alone, but your cancer cannot. In order to replicate itself, a cell has to make a copy of itself, meaning it has to make 3.3 billion base pairs of DNA. That requires some nitrogen. It has to make all its proteins. That requires nitrogens. It has to make all its enzymes. That requires iron. So by minimizing all those things, you make it real hard for that cell to replicate. You can tell if the patient's going too low in protein. You'll see their serum albumin start to drop. So that would be like an indicator when you would need to supplement. Again, this is all theoretical. I'm not treating patients with this, but I'm just saying the logic of this sounds much better than anything I've seen out there. And that's why I'm telling you. Okay, leaky gut is prothrombotic. You want to avoid everything that's prothrombotic. You want to avoid everything that's going to cause leaky gut, which means no oils, of course, no alcohol, no tap water, processed food, avoid antibiotics, and there's a whole bunch of things. Most of them come from processed food. You want to avoid all that stuff. You want to only eat organic. Forget about the non-organic stuff that's got glyphosate or atrazine in it. That stuff is toxic, okay? You want to hydrate yourself with reverse osmosis water, okay? That's probably going to be your best bet. If you eat first, you can maybe drink distilled, but be careful with that. You don't want to be hypoosmolar. Avoid estrogenic chemicals. They can cause accelerated growth of hormonal sensitive cancers, things like breast cancer and prostate cancer, also endometrial cancer. So that means avoid things like deodorant, tap water, personal care products, soy, flax, BPA phthalates. I've given lectures before about why I think soy and flax are for chumps. I think that's high-fat, phony nonsense, and I've articulated that before in previous lectures. Okay, and all these estrogenic chemicals, they're very often neurotoxic. Significant number of them are goitrogenic, thyroid toxic. You don't want any of that stuff. Okay, you want to avoid excessive dietary sodium. It's bad. Excessive dietary sodium can activate platelets. Those can stick around the metastasizing cells in your blood, and they hide the cancer cells from your immune system, because your immune system all works on Braille, feeling things. So if it's your metastatic cancer cells are surrounded by platelets, then the immune system can't feel them, can't detect them, can't tell if they're self or foreign, so it can't remove them. Excessive chloride that comes with sodium chloride, table salt. You have a fixed number of anions in your blood, so it'll displace the bicarbonate anion, which is a pH buffer, and this can lead to metabolic acidosis. So you don't want that. That's another problem with meat. It'll cause metabolic acidosis. You don't want that. Acidosis favors cancer growth. You want things relatively alkaline. Excessive fat is bad, bad, bad. Your goal should be to keep your dietary fat as low as possible. So that means no nuts, no seeds, no avocados, no flax, no soy. Okay. I've given previous lectures about soy. I know there's all kinds of corporate nonsense BS, modern research that claims soy has some protective effect. The old research would suggest that it probably doesn't, and it is estrogenic. I would recommend avoiding it, and it's also typically processed with terrible chemicals. Okay, fats, you want to avoid them as much as possible. All fats are atherogenic. All fats are obesogenic. Pretty much all of them except omega-3s that will promote blood sludge. Omega-3s still are going to increase your risk of prostate cancer, atrial fibrillation, obesity, insulin resistance, and then they're also at risk for lipid peroxidation, etc. I would avoid them. Okay, you can get yourself into all these lipid peroxidation issues. Tissue hypoxia. Fat causes blood sludge, leading to a drop in PO2 and increased risk of tissue hypoxia, which activates hypoxia-inducible factor 1 alpha, and then that goes to forming a dimer with HIF beta, and then that causes a transcription factor binding hypoxia response element on the DNA. You get increased vascular endothelial growth factor, and you get basically cancer-like physiology. You don't want that. When you get insulin resistance due to the high dietary fat, then you get acidification of the extracellular matrix, which is basically like cancer physiology. So high fat pushes you down that path of being like cancer physiology. Okay, you don't want that. It causes mitochondrial dysfunction, the insulin resistance, and other things that cause mitochondrial dysfunction, like mitochondrial inhibitors, are also bad. You want your mitochondria functioning as well as possible. It's sort of cancer physiology to some extent is a hypoxia pathway, to some extent it's a growth pathway. When I say that is, if you have a normal cell in the body, it's typically a worker. Like a liver cell is a worker. It has to maintain blood glucose for the brain during fasting. It has to handle the glycogen in the liver cell. It has to handle gluconeogenesis in the liver cell. It has to make bile. It has to detoxify things. It has to synthesize, blood proteins, acute phase reactants, and things like that. So it's a worker. It needs tons of ATP. However, a replicating cell doesn't really need that much ATP. It mostly needs carbon skeletons. It needs the carbon skeletons to make things, to make its long-chain fatty acids for its cell membranes, to make its nucleotides to generate 3.3 billion base pairs, okay, to make its proteins. And so for its purposes, it gets enough ATP just from glycolysis. What it needs is those carbon skeletons by running Krebs cycle in reverse, for example. It can do that with just glutamine. That's why you want to minimize dietary protein. That's like a top priority. That's one of the most unique things about what I'm telling you. I've never seen anybody recommend this before. That's why I'm doing it. Very low protein diet, 0.3 grams per kilograms. It makes the most sense based on the physiology from my extensive reading of cancer biochemistry. What else is bad about fat? In and of itself, it can activate mTOR. okay, along the lines of insulin resistance, insulin-like levels, elevated hyperinsulinemia, elevation of insulin-like growth factor. It paralyzes the immune system, just the fat itself, and also the insulin resistance leads to activation of the SAN, sympathetic autonomic nervous system. You want to avoid mitochondrial inhibitors because those in and of themselves can cause insulin resistance. Those can cause mitochondrial dysfunction, pushing you into anaerobic metabolism, cancer-like physiology. You want to avoid, you want organic only because that stuff in non-organic foods like the glyphosate, okay, that's been associated with increased risk of lymphoma, and that's also a mitochondrial inhibitor, so that's potentially going to, flip the switch to push you towards anaerobic metabolism because the mitochondria is not working, okay? And same thing, atrazine is also a mitochondrial inhibitor. They're both bad. Fluoride's a mitochondrial inhibitor. There's a lot of mitochondrial inhibitors. I've given previous lectures on them. I told you about that, how there was like none in the college, in the med school, and the nutrition biochemistry textbooks. But then when I started going through all the research, I quickly found 10, 20, 30, 40, 50, 60, 70, and lots of them are real common things which people would think are harmless, innocuous. Things like Tylenol, things like SSRIs, things like tricyclic antidepressants, some of them, things like statins, things like metformin, okay, fluoroquinolones. There's a lot of them. You'd be surprised. Okay, no caffeine. Caffeine decreases immune function. Same thing like sleep deprivation. You got to get your sleep, have steady hours, no working night shift jobs, avoid things that cause excessive stress. Exercise a lot to get your lymphatic flowing. You get a 10 to 30-fold increase in lymphatic flow. Your immune system works by traveling around the body and feeling things by braille. So by exercising a lot, you get much better lymphatic flow, much better immune system function. In addition, you're exercising, you make yourself tired in a good way. So I don't mean you don't have to go run marathons, but you should exercise a significant amount because you put your body into AMPK pathway, which is the restoration pathway, the maintenance pathway, in comparison with mTOR, which is the growth pathway. So what I mean by maintenance restoration is the cell's a little tired. It says, hey, we need to restore our ATP. We need some time to just make energy, get our act together. So no growth. That's what you want. It shuts off mTOR, okay? A person who's fat sitting around the couch all day with the remote watching TV, their body's like, well, gee, we got tons of nutritional resource food available. We're all loaded up on ATP. Let's activate mTOR. No, you don't want that. You want mTOR shut off. You want yourself an AMPK pathway, restoration. Each cell's saying, we got to make a little more ATP, make sure our mitochondria are working, mitophagy, all that stuff. Get some sunshine for vitamin D. Much better to get sunshine than to take the pill. There's a lot of added benefits to that. Maintain social support, get along with people, especially your family and friends, avoid toxic people, take time off from work to help yourself heal, lower your stress level, be religious. All the people in the major religions are a lot healthier. Have a strong purpose in life. Having that strong sense of purpose helps you to handle all the inevitable ups and downs and disappointments and setbacks of life. Okay, so it could be whatever you want, like for me to be the best doctor in the world to save Western civilization, that motivates me, okay? Whatever it is for you. If you're a teacher, to teach your students, a coach, to coach your athletes, a parent, to take care of your kids, whatever, take care of your spouse, whatever your hobby, your job, you have to figure out for yourself what that, the most noble, good purpose you can do that you like to do and you want to do, and do that. So anyways, this is what I think would be the best approach to reduces one's risk of cancer and to minimize the risk of cancer progressing if you have it. Again, this is all theoretical based on extensive reading and study. I'm not treating any patients with this. I am not a cancer doctor. I am not a tele doctor. I'm just saying based on the logic of it, and I've thought about this a lot and read and studied it a lot, I haven't seen anything better than what I'm telling you right here. And this is a real unique thing. And that Kempner physiology is rather extraordinary. We know this causes increased longevity in animals. We know that this helps as best you can prevent high blood pressure, prevent diabetes, optimize oxygen delivery to tissues. Okay, and we're depriving mTOR of what it needs to grow. And then we're getting our immune system to work well with our sunshine, our exercise, and our sleep, and our low-fat diet. To me, this sounds as good as it can get. If you can think you can improve on this, let me know. But I thought about this a lot, studied a lot. I'm not aware of anything to improve on this. So if you think of something, let me know. I'd be curious to hear it. Anyways, there it is.